I want to particularly acknowledge the co-sponsors. The National Center for the Study of University Engagement, which even though I'm the director, I can't quite say. So we call ourselves the National Center, which may sound a little pompous, but I don't know what else to do that, how to say that. We seek to stimulate a greater understanding of how an engaged university mutually enhances faculty scholarship and community progress. And so therefore we have put together this Engaged Scholar series, and we have done a variety of fields of interest from maybe one extreme, engineering. We had some people here from engineering. We did recently public humanities. Today we're doing health and public health, defined broadly, of course. We always, when we have the Scholar Series, invite various centers, institutes, departments, colleges across the campus to partner with us, to be our sponsors. And so today I'd like to acknowledge the co-sponsors for this: the College of Human Medicine, the College of Nursing, the Office of Faculty and Organizational Development, which is in the Office of the Provost, and of course University Outreach and Engagement, of which we are part. So those are our co-sponsors this time. It changes every time. Serena, we are really glad to have you here to talk about this topic, valuing community engaged scholarship in the academy. What this is really about is about challenges and issues. And at the last session, of course, some of the questions began to get right into some of those challenges. Serena would like to just open up today to let you begin to introduce who you are and a little bit of talking. So Serena, thank you. We're really glad to have you here.
Oh, thanks. And I'm glad that that you built this day in a way that we could have some real presentation, but also some real dialogue and discussion. And this session, is an hour and a half, so we have a bit of time to spend together. And knowing that you all also don't necessarily know each other, I think people are also here from community organizations and from other universities nearby. We thought it would be good to take a little bit of time at the start and just to have people go around and introduce themselves. And we're not asking for a lengthy, tome on everything you've ever done in your life and everything about yourself. But if you could just tell us who you are, why you came today, and if you have a burning challenge or issue around community academic partnerships in health or beyond, to feel free to share that, and I'll be keeping a little bit of a running list. After we do the introductions, I just had a couple of slides that may or may not pick up on things that you've said, but some of the challenges and issues that we've identified from both academic and community perspectives, maybe as a launching point to really get into a discussion. So you all know who I am, so do you want to start? And stand up and so everyone can see who you are.
I'm Mei Wei Chen from the College of Nursing for revision of overweight vegan mothers.
Do you, would it be fair to share the challenge that you brought up with me earlier, or even in a generic way if you don't want to kind of name names? But
the challenge is, it's to get a community buy-in and to get them trust you. I've been working with starting from 6 counties. Then because of personnel changes, dropped to 3 counties. Then we just got a grant ready to sign a subcontract. One county decide not to participate because they are facing huge budget cut. They don't see, when they have needs, they don't see this would be their first priority working with me. Complete the research. So I've been trying to figure out ways to get them, bring them together to work with me. But it has been very challenging, but I think trust is a huge issue, and I've been doing what you suggested. We did from the small project, and I invited people to be on the co-authors, and I noticed that they enjoy it very much. I keep a very open communication, and basically I listen to what they say to me, and some discussion, but they value what I do with them.
great, thanks.
Good morning, I'm Nancy Bernthal. I have a very bad cold, so my voice sounds terrible. I'm here mostly out of personal and professional interest. I have done some doctoral research and it was qualitative in nature, so I'm fascinated with this approach to research. And professionally, right now I work at Eaton Intermediate School District as a prevention specialist, and we are building substance abuse prevention coalitions in Eaton and Ingham County. Most of our work is through the schools, through the mechanism of safe and drug-free schools funding. Thank you.
Do you have a partnership in place with Michigan State or some other academic partner at all? Or?
Somewhat, but we'd like to do more in that area.
Oh, okay, great. Okay. We'll keep going around.
I'm Joan Ilardo, and I'm from the School of Social Work. And I have been mostly on the evaluation side of community projects since the mid-90s when I started as the evaluator for the Rural Health Project for the Clean House Station. I've been involved in several things since then, healthcare and social welfare projects predominantly. I teach research methods and am very interested in how I can incorporate some of the principles of the community-based research, participatory research as I teach our students and they go out into the field to practice.
Great.
Good morning, everyone. My name is Angela Allen. I'm a doctoral student in higher education administration here at Michigan State. I'm working on my dissertation proposal right now, and I'm studying the community impact of community engagement scholarship. So my challenge is how to take that document and assessment that you all do as both faculty and community members and turn that into outcomes and looking at what are the indicators of social change for your work. Another challenge that I face is as a doctoral student, continuing my involvement in community engagement with the requirements of my department and my program and keeping up my activities. So that's my challenge.
Is that what she asked for challenges?
Well, I mean, to introduce yourself, say a little bit about why you came, and if you have a challenge or issue that you want to kind of get out for maybe more group discussion later, but if you don't have one, that's fine too.
Good morning. My name is Nkechi Nyalumichiwoneso. I've recently arrived here at Michigan State. I'm here with outreach and engagement. I've done a lot of work with communities in a non-professional capacity, and that work has looked at issues around HIV/AIDS, women's health, and communities addressing whatever their community health problem was. I'm interested in issues around justice and moving away from this notion of health just being a personal issue. In terms of challenges, there is that challenge of, on the professional end, of merging these in a way that is respected, and because my academic background was not around this health issues, making that transition, is it a detrimental road to take as I go further in my professional development?
Okay.
I'm Yakov Segal. I'm assistant professor at pediatric department of human development at CHM. Actually, colleagues, me and Peter Jennings, we're working together, and we work also with pediatric residency program, doing a lot of, he's a program director and me as an assistant program director, and doing a lot of community services here, especially for pediatric community in town. And right now we're running on south side of town pediatric clinic, which based on health department, but we are taking care primarily for underserved population. And over there, as I said, we're doing a lot of community services, and right now we're also starting what we call medical home for kids with chronic health issues. And as you said, it looks like it might become like a research project, and we both hold that this type of conference might be really helpful for us.
Good morning. I'm Pete Jennings. I'm the Pediatric Residency Director excuse me, here at Michigan State. As Dr. Siegel had mentioned, I would describe our community-based research as just kind of in the infantile stage right now. No pun intended being. We have started an early childhood literacy program with the National Reach Out and Read program, as well as the Institute of Maternal Child Health. We have just submitted a grant to the Michigan Department of Community Health working on safe sleep practices, and we're in the process of developing a protocol to teach our residents about safe sleep practices, and then they in turn will carry this out into the community. We're partnering with the OBGYN program at Michigan State as well as the Family Practice Residency program at Michigan State. And if we continue to get funding, our plan is to work through cooperative extension, which is something I think very unique to Michigan State, and then spread this throughout the state.
Okay.
I'm Mike Laughlin. I teach English at UDM and a couple other places, and I work with a group, Northwest Detroit Neighborhood Development, and we're trying to develop a partnership with MSU and also a couple of other fine institutions to bring a greater educational presence into a very poor community in Northwest Detroit. And essentially that's what I'm here to learn about and to try to develop.
My name is Kirk Riley. I am the Assistant Director of Administration in University Outreach and Engagement, and I'm also part of the National Center for the Study of University Engagement. In a former position, I was the manager of an environmental outreach program in civil and environmental engineering. It just started here in January. And I think a challenge that I confronted frequently, and it's one that you spoke about with the Charleston partnership, that I would appreciate having more discussion of, is the issue of building trust between communities and academia and how those bridges can be built in order to address the issue of distrust between, especially the communities toward academia.
Yeah. Okay.
Good morning, I'm Jan Brady, and I'm a new assistant professor in the College of Nursing. Came from the Flint area where I worked with Ella Moulton Green, and so I can fully attest to the time the relationships take. And in fact, we're currently working on a manuscript, submitting it to the new journal out of Johns Hopkins, and I can't remember the name either. So I'm looking for some new areas that I can work on with CVPR because I have a passion for it. So I'm here to learn what's going on in this new community. So nice to see you.
I'm Kristen Murray. I'm a doctoral student in the Department of Kinesiology, studying growth and motor development and sports psychology. And pretty much have an interest in youth sports and understanding and getting the positive benefits from sports participation. So I'd like to work within a community setting later on as well, doing like coaching and parent education and building up youth sport programs.
Good morning, I'm Terry Werwin. I'm Assistant Dean for Partnerships and Practice in the College of Nursing. And a couple areas I'm involved in. One is in our partnerships with healthcare organizations. We're looking at ways to address the nursing shortage by supporting nurses who have been away from practice to come back in and partnering with the healthcare organizations to help them in their preparation to come back and help them into positions. And we will now be looking at a new project that involves helping nurses transition to more community-based work, and again, working with the health systems for nurses looking to move into settings like hospice, home care, and long-term care settings where there is emerging need based on the aging of the population. And another project working on in this community specifically is with the Lansing Public School System, where we have been working with a number of people from the college with a program with the school nurses, where we've been increasing the number of students that are doing clinical experiences and learning and working with the students, providing some professional development opportunities for the nurses, and now we're looking at other ways that we can serve that community better, having spent the last couple of years building that groundwork.
Hi, I'm Della Davies. I'm the chairman of Pediatrics and Human Development in the College of Human Medicine. And I have a very strong interest in community partnerships. We right now we're working with a number of people here to on a proposal to try and create what we call an integrated child health center, where we take all the community organizations that work in the area of child health and take all our strengths within MSU and come together around the table and see whether we can create something that adds value to the community. Some of that would be virtual, and we're hoping some of that would be real in terms of an actual location. And some of the benefits we see is as addressing specific issues that the community has, but also from the university's point of view, having an opportunity to actually engage directly with community partners in research, education, and other needs, and actually fill gaps that are currently unmet in the community. For example, we all know that there's a huge mental health issue in the community for children, and hopefully a center or whatever we call it like this will actually enable us to do that. We have been meeting regularly. Teresa is one of the people on the committee as is Pat, and we've done a lot of work. We have Lansing Community College, Michigan Department of Community Health. We have Ingham County Health Department. A number of very sort of well-connected partners in the community working with us, and we have the blessing of the provost. And we just submitted a catalog proposal for a planning grant towards this concept. So certainly anything that helps us to engage more in the communities of specific interest to me. I'm on the advisory board for FACT, Families and Communities Together. And I really enjoyed my interaction with that, and we've been working on an obesity initiative. So this is really something that's very germane to my department.
That's great. It's exciting.
I'm Pat Farrell, and I'm Director of University Community Partnerships here, and our office is right below us, on the lower level here. My big challenge and our big role for our unit is really to help communities link with faculty members, and help faculty members link with communities that have interests, and help to mutually develop partnerships that make sense for both sides. One of the ways we do this is through the FACT Coalition and through University Outreach and through Michigan State University Extension and MAES, Ag Experiment Station, is to offer a grant competition once a year for community-based partnerships. In fact, it's for faculties to work with communities in a participatory model. And that we are actually having an announcement about that will go out tomorrow and Thursday. We'll have sessions over here at the Kellogg Center. So I encourage you, if you're looking for seed funds, they're not a lot of money, but it is enough to maybe get you started through that long period when you're just doing planning and when you're working with the community. But it is a way to take a look at issues and one way to get started working with communities. If there's anything that we can do to assist you in either finding partners or looking at other funding mechanisms that may be out there, please let us know. We're at the university website, University Outreach.
Oh, great.
I'm Helen Hergensen, professor of pediatric nursing, and these are my colleagues here. Basically, my focus is really on prevention of childhood obesity, really focusing on infants and toddlers. Dealing with early Head Start, we have early funding grant where we're working with 8 early Head Starts in 20 communities. So we really have a community outreach partnership. Also have a Medicaid grant with Extension, is another wonderful way to really work with regarding community partnerships. We do have, I enjoyed the person's remark regarding trust, and even though sometimes we're able to make these linkages, especially with working with some of our diverse populations, is able to maintain those linkages and stay connected, especially when we're here in East Lansing and we're working with people in Detroit. So ways to really foster that, that once we've got commitment and unity with them and staying connected with the participants, but also with the agencies that we're working with, has really been a challenge for us.
Good morning. I'm Claudette Buckingham from the College of Veterinary Medicine here at Michigan State University. We're exploring, looking at community partnerships that we may develop as we look at, in particular, public health issues and veterinary medicine.
I'm Rachel Fisher. I'm in the Department of Pediatrics and Human Development. And for the past 8 years, we've had a community project involved with the genetics of deafness. And that's been actually quite challenging because we've had to deal with the whole question of genetics and genetic information. We've had a very positive experience. We've had really very keen community members who've been stuck with us all the way. And I have to say that getting the trust of the community has been actually quite challenging, but we feel we now have them really working with us extremely well. In fact, one of the really wonderful moments, the last meeting we had, the most skeptical member of the advisory committee that we have said to me, "You stuck with it,"
Yeah.
which is really nice. One of the problems that we have, it's hardly a problem, but it's an interesting question, and that is the disconnect that we see between the University ILB committee and our own ethics committee within the community, because the issues that they have are so different from the issues that the academic ILB committee see, and sometimes they're just absolutely opposite. And it's not too difficult to deal with, but it would be nicer if the university had a better understanding of what each particular community that you work with has, because they're very different, I'm sure.
Yeah. Okay.
I'm Sue Hahn. I'm with Community Mental Health in the Lansing area here, Clinton and Ingham counties, and we serve individuals with developmental disabilities, mental illness, emotional children and families with emotional issues, and substance abuse problems. And I'm basically here just to learn about academic partnerships and how our agency might be able to hook up with some of the initiatives that are going on.
Okay.
I'm Dozier Thornton. I'm a retired clinical community psychologist who has been permitted to have some space and associate with people in outreach and engagement here. Some of my last research before retiring dealt with children and facilitating particularly young Head Start children, their learning of delay of gratification. But now my interest links to these things. It would take too long to clarify how, but I'm working to become better at art, sculpture. And one of my goals there is to see to what extent through art one can facilitate human dignity. And I think that also relates to community engaged scholarship, as I do it. Thank you.
Yeah, great.
I'm John O'Brien. I work with Mike at Northwest Detroit Neighborhood Development. And again, we're a community-based organization looking for ways to develop partnerships to bring the resources of the university into a poverty area of the city of Detroit, both in terms of how do we share resources and how do we clearly benefit the community through that type of a partnership.
Hello, I'm Patricia Obando. I'm a new assistant professor at the College of Human Medicine at Block 3. I've been involved with community-based research some time ago. I'm originally from Costa Rica, so I did a lot of work with communities over there and anthropologists working in the medical field. So right now I kind of want to go back to it, and basically I'm here for personal reasons. I'm interested in starting my own research projects, and I'm working with health disparities issues right now and working with underserved populations in Saginaw. And maybe my biggest challenge right now is how to communicate the need of doing community-based research to medical students, third-year medical students. So for me, it's a challenge right now. So anyway, I'm here just to learn a little bit more and try to get some helpful tips.
Hello, I'm Claire Laws, and I'm Director of Education and Outreach in the Dean's Office of Research for the College of Human Medicine. So I work with a number of people in this room, and our role mainly is to help build research infrastructure and productivity and engagement across all of our campuses. I don't know how many of you know we are a community-based medical school. We have 6 campuses, and we are hoping, what we're trying to do right now is really to build that into a statewide network where we have research being conducted across all of the campuses in partnership with the communities that the campuses are in. So we are always looking for what are the challenges to doing this, what would better serve this mission for the college. And trust is a huge issue, communication, keeping communication, making better use of distance technology to be able to link the campuses, and how do we bring students into the mix too, and residents, and make them part of the research team. So I'm glad to be meeting people from the community as well as other units across campus, and to use this as an opportunity to build relationships.
My name is
Speza, and I'm an undergraduate student, so I just came here to kind of listen to everyone, and I'm interested in going into community medicine. So.
Hi, my name is Vivek Joshi, and I'm associated with the National Center as a developer as well as a data analyst, and I'm here for intellectual curiosity and listen to the challenges people have, the tools they use to overcome those challenges, and think about new tools that we can use to further overcome the challenges.
I'm Gada Georges. I also work for University Outreach and Engagement. I'm the information architect, one of the information architects. I work on our web-based content, and it's always a good idea for us, for people to listen and sit in on things like this, just to get more content knowledge and understand how people use the language that they use.
That's good.
I'm Renee Kennedy. I'm an assistant professor in the College of Nursing. I do work on social determinants of health right now, looking at the role of discrimination in pregnancy outcomes, and spent last summer collecting data in collaboration with the state health department and local health departments on pregnancy experiences among African American women in 11 communities that have the highest Black infant mortality rate. Really intrigued by how we define community, both in terms of composition as well as level. My community in the work last summer really was local public health, but really challenged by how you really link those with the women in the communities and sort of the return, what's our responsibility to return the knowledge to the community. So we're still kind of grappling with, but what did you do with the findings? What did you do with the data? And trying to motivate that community of practitioners to engage the community of service more effectively.
Hi, I'm Lorraine Robbins. I'm an assistant professor in the College of Nursing, and I've been here about a year and a half or so. And I'm interested in increasing physical activity in middle school girls, and I'm planning to submit an R21 proposal to Heart, Lung, and Blood in February. And I'm interested mainly in trying to get some ideas to sort of enhance collaborative efforts with the schools. So if you have any ideas, I'd be very interested, because I really feel that this is an intense effort that will require basically everybody in the school system to get on board, parents, teachers, principals, and anyone else involved, and the school nurses.
And who are your current partners from the schools? When you say all of those need to be involved, but who is involved right now?
Right now there are school nurses involved. I'm starting with the nurses. I realize that I'll probably have to go into the parent-teacher organization. I haven't really approached the principals. The superintendent, I think the superintendent of the Lansing School District seems to be on board. And I haven't really approached the teachers yet. So I'm sort of in the process of trying to build those relationships. Okay, thank you.
Hi, I'm Kathleen Oberst. While I am a nurse, I'm actually in CHM. I work for the Institute for Healthcare Studies. And I'm also a doctoral candidate in the EPI program. So actually I'm here to learn more about this, especially with EPI, as we focus so much on the individual to try and get the broader base, the ecological base.
Hi, I'm Farron Sapanich-Goldner. I'm an academic specialist in the Community and Economic Development Program, which is part of urban and regional planning in the School of Design and Construction these days. My current work is mostly in economic development, working with local economic development practitioners on transitioning their practice to the knowledge economy. But in the health arena, there are some local activities in Ingham County that I'm involved in with data democratization and with some community indicators of the quality of community life. And our biggest challenge, for me personally and in our unit, has been, I think, ours is an outreach unit off campus in downtown Lansing, and I think our challenge has been to deliver on the university side of the ledger, publications and and research that is that meets the criteria for peer reviews. We've been actually pretty successful in on the community side, making partnerships that feel effective to our community partners, but at the expense of sometimes succeeding on the university side. So that's the balance I'm seeking to shift in my work.
Hi, my name is Mary Beth Holtz. I'm in Faculty Affairs and Development and Human Medicine. On the faculty development side, we work with new faculty and supporting them. We have orientation programs, a mentor program, college-wide mentor program that's been established. There's evaluations of the programs that we do. On the faculty affairs side, we work with reappointment, promotion, and tenure for the college, and that was my interest in how to incorporate some of the criteria into the college process. There's a detailed criteria list that was developed in the college that faculty can look through so they can see what the criteria is for promotion, so we'll be including this portion of it in the process.
Hello, my name is Bill Wadman. I'm the chair of family medicine in the College of Human Medicine. In our department, we've had a number of funded projects that are community engaged. Some from the state of Michigan, many from Robert Wood Johnson, some from NCI and Herschel. We have a grant right now that we call the Prescription for Health, which is an issue that often in clinical practice, in rural practice, or urban practice, physicians are sort of struck with a term of urgent care, and so there's little focus on preventive care, or they have little time for preventive care. So the model there is using a health educator model, supporting community practices, and we're comparing Flint, Michigan, which is where Michael Moore came from, a highly industrial community in the Upper Peninsula, using this health educator model. And it's really looking like it's very effective. Another project that we did in partnership was with Blue Cross Blue Shield of Michigan, with Robert Wood Johnson developing a quit line service for tobacco that is now incorporated as a delivery service by Blue Cross to 6 million people. So we're pretty proud of that. I'm also working with Mary Beth. I'm the Associate Dean for Faculty Affairs and Development. For our college, we do not have community engaged scholarship defined as one of the criteria for promotion. So I'd like to learn how to get that into our criteria. I know your institution, because I was out there actually this past year working with Paul James several times. I'm very impressed that you got promoted at the University of Washington, which is a very rigorous place to...
School of Public Health, not the medical school, but I don't know, I think I probably would have been promoted in the med school. I had started out there but moved into public health. But I can tell you more about that.
So I'd like to learn more about that. So that's one issue. The other issue is that we had difficulty this past year. It was also the PI for AHEP in Michigan. We had the first go-around of funding. We applied for the second go-around. Our match was state funds that we send out to our community campuses. We have 6 campuses. So it's money that comes out from the school, does not stay here in Sarena. They did not feel that was legitimate match. And they didn't seem to understand a community campus-based school. Because most of the reviewers come from places like Chapel Hill or traditional schools that they have community outreach, but they don't have a community campus model. And so they were sort of critiquing us for funding our own infrastructure. And the truth is we have a community infrastructure. So I guess I'd like some suggestions of how to convince the feds who we are, what we do, because what we do is pretty amazing. The return rate of our students to community coming back to Michigan, going to rural communities and underserved is about 60–70% for our medical schools.
Do you want to just define what an AHEC is? Because not everyone may know what that stands for and what that means.
AHEC is Area Health Education, which is federal funds that require match funds by communities for training health professionals, particularly to serve the medically underserved. So it's for all health professionals to return back to those communities and pretty much go to places that are designated medically underserved.
Hi, my name is Maria Valenti. I'm a graduate student here at MSU in the Ecological Community Psychology program. Right now I'm working on my comprehensives and where I'm investigating participatory action research with the youth population. I'm here to learn. I'm really interested in collaborative research and how to negotiate working with the community with the demands of being in a research-one institution.
Great. And did you want to introduce yourself? You had
Hi, my name's
Oh, I'm sorry.
James.
There's somebody else back there. I didn't see you. I'm sorry. I thought we were already up front.
You thought you'd never get here and you still have
I'm sorry. I need to stand.
My name is Katie
Yeah.
Snyder, and I've been trying to figure out how to identify myself to this very impressive group of people. I am not an academician by trade. I have worked, however, in the community level for many years, and I have definitely developed a real passion for how to mobilize university resources to help communities in a wide variety of areas, whether it's environmental health, or economic development, or trying to transition from the structural dislocations that we're experiencing now in Michigan to being able to survive in the new global economy. So I'm looking forward to hearing and learning more this afternoon and what's left of the morning, and we'll get on to the very last.
Thanks.
Yeah, I know this.
Good morning. My name is Tim Wolfter. I'm Associate Director of Corporate and Foundation Relations. That's a unit in university development. I'm here to just learn more about the community-based research and in particular how these projects are funded by the private sector.
And there were some other new people that came in. We're just asking you to introduce yourselves and any challenges you may face in this work that you want to get out on the tables.
Thank you. I don't have any public challenges. I may have some personal challenges. My name is Terry Walsh. I work in the Office for International Students and Scholars here at MSU, and I'm responsible for community outreach to partner international students with the community, through the government, through businesses, through the school system, and the health is a new field for me. So I'm interested in how all of you do that, how you make those partnerships with the community and the university in the health field, and maybe I can take some of those best practices back to my own work. Thank you.
Okay. Did we miss anybody else in the back? Yeah.
I'm John Melcher with the Community and Economic Development Program as well as Outreach and Negotiations here at Michigan State University. I've been working in this interface between community and university for a number of years.
Okay.
Just here to learn more.
Great. Yeah.
I'm Julie Hagstrom. I'm a program manager with the National Center for the Study of University Engagement here at University Outreach and Engagement. And aside from making sure that today's events go smoothly, and it's very interesting to me professionally to meet all of you and to get a first-hand experience with the depth and breadth of what's going on at Michigan State and in the communities that we intersect with. So welcome, everyone.
Did you want to add any challenges or issues as we get started? Or?
Our big challenge in the National Center for the Study of University Engagement is actually finding quantitative data to talk across the university on what is actually happening here by department, by the whole university, and finding even typologies to talk about that so that we can compare ourselves with other, especially Research One universities, but others. And then the second thing that we're very, very interested in is we changed the promotion and tenure guidelines here 5 years ago at Michigan State. And what we are looking to do now is a study on to what effect has it been used and who's using it and how has it trickled down, if you will, to departments or review committees. And we're going to be interested to see what we learn and what we should do next.
So just picking up on that, the changes that were made, and then you mentioned in the medical school that it's not in the guidelines. So does that mean you have separate guidelines that are different? Okay, so each school sort of adopted its own.
Some do, yes.
Okay. And thanks for indulging the kind of lengthy time period we devoted to the intros, but that was part of the point, for people to get to know each other and hear what is going on. And so one place to start, I mean, several of you brought up, and it's very foundational to these partnerships, the issue of trust and relationship building, trusting relationships. And I'm just wondering, at least as a starting point for discussion, most of you have an affiliation to Michigan State in some way in this room. What is the impression of Michigan State, do you think, in the community? I mean, are there, for a lot of these relationships, the trust, to some extent, is built on the history and the baggage, if you will, of that institution that may have come way before your presence here as a faculty member in the community. And what is there collective consciousness in this room of what is that for Michigan State? I mean, are there issues there or not? What kinds of observations do you have about, you know, being a faculty member or staff member, working in the community, coming from Michigan State? Yeah.
The first thing that everybody talks about is the football team.
Yeah.
And then they talk about U of M football team. So clearly it has quite a high profile with the sports program. It's if you get them to move off there, then they start talking about well, as far as I'm concerned, they start talking about the medical services.
Are there other observations that you have? Yeah.
I think one of the things is because we're located here in Lansing, and the other two research institutions in the state, both Wayne and U of M, are much closer to southeastern Michigan. There is a sense of disconnect that we are not the university that is available to engage and align with southeastern Michigan, which is a tremendous urban pool of individuals and communities in which we would like to work, but we're not always perceived as being the university that is there because of the other two universities' physical location.
To counter that, however, I've had personal experience with several faculty from different departments in urban and regional planning and community psychology who have built significant relationships in Detroit and Battle Creek communities with different neighborhoods and different community-based organizations who have taken more initiative over the last 10 years than Wayne State or the University of Michigan in doing different projects in different areas of research. So it might be geographically dependent on what relationships they have with which faculty members and which students on different projects.
There certainly are a number of projects where people are very successful, but particularly in my discipline, because nursing is so engaged within the community from those two institutions, we're not really perceived as the local institution.
Okay. Yeah, let's go around it.
You know, there's a long history of the success of the Extension Service and the Agricultural College, which this university was founded on. So when you go to sort of the back areas of Michigan, Michigan State is really out there. And where University of Michigan and Wayne State, University of Michigan has sort of got this global focus. So at the grassroots, there's a lot of respect for MSU among farmers and working people. And I think it translates into other disciplines too over time. So.
There was a
I
hand
think that's
here.
true in the city, that the Extension Center is, there's a perception that the university is set up to be able to have a local presence, and the Extension Center offers that. Clearly, distance is problematic. I mean, that for students to be able to come to Detroit for an afternoon or a class, it's just a half hour too far, so to speak, to make that convenient. So that's problematic. But the Extension Center offers a mechanism to override that or deal with it.
Yeah.
I have kind of an opposite approach. I'm an alumni of Michigan State. I've lived here since my graduation, 30-some years, and I've worked for local agencies that hold time schools and other human service agencies. And we would love to partner more with MSU, but it's like, who do we call? Where do we start? It's hard. I didn't even know about Lucy. Who's that? We're good. Yeah, that was so cool to hear about this morning. But you know, it's sort of like I've lived here a long time. I didn't even know about that or how to get started.
I do think I think that's an issue. It's an issue also internally because it's a problem if as a community member who would come to us and not knowing who across campus faculty members are easily interested in this kind of work too. So we're trying to think of different ways that we can help to connect people better. But I think in the issue of trust, I know that I used to work for a Lansing School District for a number of years before I came here. And I know that, frankly, if we had another person coming from Michigan State, we were not real happy. Because the research was frequently just for research, for their research, and not for improvement of students, and not for long-lasting program changes, which is what we were looking for. So when I put that hat on, I know that when you're a close community, and maybe the other people in Lansing don't feel this way, but when you're a close community, that sometimes, unless you've had a long relationship in the community with people who realize that you're not going to take that approach and are really going to do it a participatory model, like the programs that John does, which are right-based right in the community, but which has other consequences for him when he follows more of a community model. I know that there is that sense of distrust that you have to overcome if you really want to do work.
Yeah. Other comments on this issue of trust and the relationship really with Michigan State? We'll start in the back and then you, sorry.
Well, the trust issue is very real. We're, right now, our office is taking road trips and we're going to each of the campuses and talking to community deans and research directors and trying to build this relationship and let them know that we are serious about and sensitive to, I hope, about being true partners. But over and over we hear this history of people researchers from Michigan State coming in, doing their research, not having it be necessarily even relevant to the community, but not sharing the data later, the findings later. We've heard several times from several communities this concept of drive-by data collection. We go in, use their patients, get their data, and leave, and they never hear from them again. So it's a matter of really building these trusting relationships and letting people know that we're serious about being true partners and about them being a part of the research team, having the research center around their needs, sharing the findings later, having them be part of publications and all of the products that we value. And it's really a matter of people like Dr. Davies and Dr. Wadland and the AHEC program and getting out in the community and serving the community through research. So it's really a challenge that we're facing, a long history of sort of residual distrust and just not really positive.
Now, are you at a point, or do you expect to be at a point where you would be codifying this in some agreement, kind of contract or principles of agreement or a memorandum of understanding with the communities you're working with that spells out your intentions and the principles behind what you just said? For example, that this is the collaborative that we're going to work with under. We're going to co-write. We're going to co-author. We're going to, we don't own the data. It's jointly owned, or maybe it's community owned. I mean, are you thinking at this point along those lines at all?
We hadn't talked about codifying it. No, we've just been talking verbally, just
Yeah.
trying to build these trusting relationships and letting them know that we're serious about this and what is it that you need in this community in order to make research partnerships with MSU possible.
Yeah.
And we're running into things like the IRB issues that were raised, the promotion issues because the promotion and tenure guidelines for people on this campus are much different than for our community faculty or the clinicians out there where we want to do research at the point of care. Promotion guidelines, for them might be different issues than it would be for an academician. So just finding out what it is, where we can meet them in their world and build these relationships.
There are a couple of really important points you're making in your comment. One is that dialogue process and the listening, and you're not preempting that by, well, we have this grant, or we have to go for this, or we have this deadline. I mean, it sounds like really taking the time to listen and be a part of a discussion. And I think so much of building this trust is earning the trust by the way that you actually behave. Because it's one thing to say, well, we want to and we will, but to really start demonstrating it in the way that you're acting and in the way that you're having these conversations and the responses. I mean, one of the problems I think a lot of institutions get, and not just universities, public health departments and government, is you promise more than you can deliver, or you offer things that you really don't have any control over, and to take it in that kind of slow, developmental step is really key.
Well, we've actually had two different communities tell us just that now. One said, because we said, well, what can we do? What can we do? Well, it's just going to take time.
Yeah.
And you're going to have to come back. You can't come just once and say, look, and show your face just once. You're going to have to come back and back and back. And it's about, going out after this meeting for a beer and getting to know us and things like that. And another community just recently told us the same thing, that it's really about getting to know us and developing long-term relationships that may or may not have anything to do with a particular project.
Right.
But just learning about us and our community and showing that you're interested and then following through with what you say to them.
Yeah. Well, and that's where those I don't know how many of you were here for the earlier talk, but the questions about is CVPR right for you? You know, I mean, if literally you're sitting there saying, I don't want to, you know, I don't really want to be doing that. That's not what I'm doing in my academic world. Then you shouldn't be doing it. You know, I mean, there are questions about, because it's true. What you're saying is absolutely true. These relationships. Are you spending time outside of the research project? You know, socializing, getting to know people, having a presence in the community that goes beyond the specific research agenda. But this really involves a lot of kind of self-evaluation, I think. I'm not picking on you. I don't mean that. I just mean in general. You know, to be able to really do this work. It really is a very intense relationship building process. Yeah, I'd love to just hear more comments, and then maybe we'll stop at different points. And oh, and I'm sorry, you had a comment that you actually wanted to make next.
Mine's real brief.
Okay.
Because I don't have a long history here at MSU, but I know that in working with communities and on CVPR projects, being comfortable with giving up control was always a challenge, and that came down to, we did establish guidelines for authorship, things like that, but when you have community members and academicians writing a manuscript, that looks very, very different. And giving up that control was a real positive challenge, so I mean, that helped cement more of a relationship.
How were you able to do that? Was it, I mean, was there some light bulb that went off, or certain things that happened that, or was it just a process of working together and seeing that the final product was actually fine? And
right, and being willing to take 10 steps forward and 5 back, and looking at it, trying to see it out of the community's eyes. And obviously their reasons for participating in writing a manuscript are very different from ours sometimes. And trying to find that common ground. And maybe this manuscript would be okay this way, and in another time period, you know, maybe go the other direction. It's giving up that control.
Yeah, giving that up. Okay, that's good. Yeah, in the way in the back.
Speaking to trust, it's a commodity that really goes with individuals more so than the institution. We generalize about the institution, and oftentimes, you know, you go in a community, and I don't care what university you're from, frankly, you're liable to be that pointy-headed researcher who's going to come and go. And you get that at no matter what, no matter who you are, no matter how good the work you do. If you're meeting someone for the first time, that is oftentimes a default relationship that seems to pop up. I'm just sharing with you what I've observed. And that to overcome those is really important. And you overcome that by the kinds of things you were just talking about, time spent in really developing a relationship. But you got to recognize too, also from the university, any one of your departments that you're from, there are people in that department I know you don't like or you don't want to work with. Now, so just think about this. Here's your colleague sitting right next to you at a faculty meeting, same subject matter, same university, same department, same everything, and yet one of you may be very acceptable and able to work, and the other one can't. And it has nothing to do really with the university, with the subject matter, it all has to do with you. Yeah. And I think that oftentimes gets way overlooked in this. And I can have the same personality, multiple personality, like here in the Lansing community, I mean, just in the last week or two, there's one project that I'm out there trying to talk about and work with, and people are really skeptical about it. And yet I go to another neighborhood community meeting, and they go, God, we're really glad you guys have been here for so long, and it's a really, you're one of the only partners that have been standing with us over these period of times and all of that. And so you get the same, and actually I can get this from the same people. And it has to do with, they don't know who from the university is going to be out there working with them. Right. And they have had enough experience to say, you're not all the same. Some of you are okay and some of you aren't. But the default will be caution. By and large. That's just been my experience.
Well, and the more, I'll have a few slides to show later, but we had a summit in April of community partners from across the country, and we really learned a lot from their perspectives on working with universities long term. But this came up a lot, that the more savvy partners who really knew how the system worked and how to navigate it, they found the right people. They found the people who really were totally on board with the values and the principles, and and then there's vast swaths of the institution that they just didn't deal with, and they knew they really not to. And but it is hard figuring out, and as the woman who just left talked about, I wanted to ask her how she found out about this talk today, because sometimes it is difficult to make an inroad in. Yeah, there was a comment here.
I came from Alberta, Canada, about 3.5 years ago, and I just want to bring a couple of ideas to the table about what was going on there. At Alberta Children's Hospital, there was actually an institute that was started primarily to address community-related research questions.
Okay.
And so the head of that unit was actually judged not by, necessarily whether she had 10 publications in New England Journal of Pediatrics, but how many questions that came from the community that came to her, and actually jointly the community and her went to look out for funding, and actually they got funding from unusual sources, where they were able to actually get some of it through some of the annual drives, for example, that different organizations we have. And she's actually been very successful in this. She's been able to hire a whole team of researchers, because the challenge in academic institutions is that we train our investigators to think primarily about their own investigator-initiated research.
Right, yeah.
And so now we ask them, somebody comes with a question, if it fits in with their research project, all well and good, then it's a natural fit.
Right.
But if it doesn't, then it becomes a real challenge. But if you have a team of people whose primary purpose is to try and address questions that come from the community, and obviously it has to be seeded initially, and over time, then you can actually start to, the irony of it is they actually were able to come with a lot of very good research, very well structured papers that were actually published. And Suzanne Toth is her name, I don't know if you know
Okay,
her.
yeah, I do.
Suzanne,
I know the
she's
name,
done an
yeah.
outstanding job with just building up that unit. And the other thing, another issue to bring to the table is also in Alberta, they have something called the Alberta Heritage Foundation for Medical Research. And what they did was they said, okay, the number of people in the community who don't have time to really understand about research, they'll never be researchers, but they want to do research. So what they do is they have these programs where they bring somebody in for a fellowship for a year, where you're coming for like 2-week blocks, maybe 2 or 3 times a year, where you're given intensive training on EP and all that. And so they go back home feeling more knowledge. Obviously, they're not going to be writing grants or whatever, but they have much more knowledge about research,
Yeah.
and they can actually have much more meaningful conversations, and they can actually be much more involved in the facilitators within their own community for research. So this is really something to throw on the table about how, as an institution, we may want to consider a model where we actually say, okay, we send out emails to people saying, are you interested in this topic? Well, if there's nobody who's interested in it, that community partner loses out.
Yeah.
But if we have a unit that's totally dedicated towards helping, working with that organization to answer those questions, and of course, then we can start looking at innovative methods of funding that. And then actually that could become a career track where it's not necessarily limited by this person's own initiative or imagination as to what they should be doing for their own research, but it's actually seeded from the community.
Yeah. And I'm glad you brought that model up, because Canada is actually very progressive in doing some really exciting things in this whole area. And another model yet again, which is a little maybe more long-term training capacity building, is in Toronto at the Wellesley Institute. I don't know if you've connected with them at all. But they, it was a hospital system, long story short, basically a hospital that got closed, and the assets were devoted to this philanthropic organization. It's kind of like a Conversion Foundation, but not quite. But they have started a certificate program in community-based research for community members. And so community members take these courses. It's primarily community. There are some grad students that have taken it too. But it might be a course on how to design a research project, how to do a survey, how to do a questionnaire, how to go through an IRB. And now they've hooked up with the university to get academic credit, so the community members can get a certificate or credits toward a degree. And their hope is that long-term, the community members will be applying for grants directly themselves, and will invite academics as partners on the team if appropriate. But it's part of a long-term process to really build up the research skills of community members, and also to have an effect on evidence-based practice in community organizations, so that they're starting to really think more about what evidence is and what evidence they need to show that what their work is doing, that their work really is making a difference. But I mean, there are a number of models, and there's a lot that you guys are doing to help support this. So I mean, that's a question to put out for the larger group is, what things could MSU be doing as an institution to be more supportive and helpful to you in the work that you're doing? I mean, everyone here, almost everyone brought up a challenge. Is there a venue for figuring that out with someone collaboratively, you know, I mean, whether it's the National Center or the Community University Partnerships, you know, are there ideas and thoughts you have on that piece? Because you have folks in the room who really are listening for how can we be more supportive as an institution.
I'd like to thank you because I actually did my internship at Wellesley Hospital, and I never knew what happened to all the money that from the so I'm glad to know.
You know what I'm
gonna?
I'm actually gonna get you a present because there's a book. There's actually a book that just came out that chronicles the entire history of what happened to Wellesley. It's a really interesting story. Their whole focus now is social change in urban communities. That's cool. Yeah, one of our board members is from there. That's why I know so much about Wellesley. But yeah, on the question of support and support for faculty, but also for community organizations that want to try to access this place. What do you think needs to happen? Yeah.
Well, I mean, somebody made the comment, are you going to send out the list of
Right.
people because we'd like to network? And this is a huge place, and there's a lot of us doing things that are very interconnected, but we don't know it. And there's really no, as I think we're all saying, formal mechanism for us to say, I'm interested in this, is anybody out there? And I mean, how many times have we pieced together a team of interdisciplinary researchers to apply for a grant, people who have had no history together. And so the funders look at it and they know what you did. They know you made a bunch of phone calls and got people's CVs together and said, let's throw a party and do a research project. But we really, I think all of us are just thirsting for something that's very purposeful as a method or a way for us to connect with each other. And I think we've heard over and over in this room that we want to do things that are meaningful in the community, that the research should be applied, that it should have a societal benefit. And I would love to be able to do more than just talk about that.
I think you have a volunteer for your first. No, I'm just kidding. But no, other comments on that? Yeah.
I think actually that it's interesting what you say, but I think that it can go much deeper into the university. Actually, our project interfaces with the community in a really meaningful way, but we take it right back into the microbe and to the molecular biology lab and to the kind of the test tube gene state, and it flows very neatly, and the information goes both ways, because what we learn we take back to the community. They're really interested in able to know about it. So I don't think it just has to be community-based researchers all working together. I think it has to go back right into the heart of the university as well.
And one of the comments from this Community Partners Summit that really was said over and over is that from the community perspective, that these partnerships often don't get anywhere near social change and real social justice. And one of the issues that came up a lot, which is something that universities have a lot of control over, is who they admit as students and just the opportunities, the educational opportunities, if not, admitting a student from this community. But and several of the partners in this discussion talked about how they negotiate as part of their partnership. In fact, I'll give you a real-life example. Vicki Ibarra, Yakima Valley Farm Worker Clinic in Yakima, Washington, who basically their agency says, if you want to work with us, we'd love to partner with you on research. We want to understand the migrant population better and serve our clients better, et cetera, but we want to have access to our Hispanic kids to the University of Washington. And so they're not at the point, and I don't know if they will be, but demanding like certain slots or whatever. But they have all kinds of programs now where kids from the Yakima Valley are touring the campus. They're meeting with students. There's mentoring programs. There's building into grants this piece. And it is bringing it more into the university. It's not just that faculty right at the front level doing the research, but wait a minute, what about our systems and who's on our admissions committee and what are we doing to be accessible to Hispanic students in our et cetera.
We brought children from our community into the university to experience a genetics lab, and they came in a class and did that. So, and I think that was very much appreciated.
Yeah. And it does. It builds capacity and some accessibility and understanding of new fields for these students. The other element of it that came out in the summit was, just as powerful as it is right now to have folks primarily from the university in this room, what about a similar room like this with all the community partners that you work with, talking to each other, about what they're doing with the university, how they've been able to access it, and then expanding out beyond that to those that don't even have any idea how to access MSU. There's a real network, I think, to be formed from the community partners too, to learn from each other. Another partner may not know that this would even be a possibility. Oh, that'd be great for kids in our community to have that kind of experience. But if they're not talking to each other about it, they're not necessarily going to know. Yeah.
Yeah, another test of university investment is to actually put tenure lines out into communities. And we've had a couple of those in our college, and that have been really successful. One was in the Upper Peninsula, and the person out there obtained full professor status and established a whole network of research involving staff of clinical practices as well as physicians. And what else do you do in the UP in the winter, basically? So these people came together, and so there was a whole series of investigations just on rural health. So far, we haven't reinvested in that, but I think that could be a challenge back to the university. If we truly are a land-grant institution, that we ought to invest some of our really base funds in our communities with full positions.
Mm-hmm. So these are folks that are primarily, this person you're speaking
People
of
like
is...
you who lived outside of Seattle.
Okay. But I mean, so this person you're speaking of is not a full-time paid faculty member at MSU, but is a...
Yes.
Oh, it is? Okay.
Full-time paid faculty member.
Okay, but located in a community
in
setting.
Escanaba, Michigan.
Okay. Yeah, I think the health sciences maybe have done that more than a lot of other fields because, like, for example, the WWAMI system in the Northwest, there are faculty, full-time faculty positions that are in rural settings, and Minnesota has the same with their rural program. There's probably a lot that the rest of the universities could learn from that. Yeah.
I just want to return to the issue of trust.
Yes.
There's an underlying assumption that as researchers we deserve to be trusted, that we are trustworthy. And what is that coming from? Is it coming from these MDs, PhDs, whatever our academic credentials are? And when we talk about this issue of, a community should find trust with us because, we will make them co-authors or we'll help them, they will help us design the methodology and so forth. Maybe that is insufficient. And you are not a part of the community, so maybe that's the baseline. Well, you don't deserve my trust.
Right. And it is deserving and earning. I mean, that's a very, very good point because it's sort of, running around saying, well, how can I gain their trust? Well, are you trustworthy? Are you worthy of that trust? Have you earned that trust? And you're right. I mean, there's some barriers that are huge to overcome, including not being at all from that community. But how would you turn that around in terms of how to earn that sort of trust in a community? I mean, from one standpoint, I would say, you're not entering that community with a research idea in mind. You're not entering it with maybe even the agenda to do research, but to just be open to what the possibilities might be as an opening for relationship building.
Also, perhaps you should be doing research in communities that you do belong to, rather than always seeing this other entity as a place that you should go and do research. Because since I've been here at Michigan State, which has only been a month, I find it interesting that somehow Detroit is considered the laboratory for all these places to go and do research. I don't understand why that is.
As opposed to right here in your own community right here. Is that what okay, yeah, as one example, yeah. Thoughts on that question? Or you had your hand up first.
Just the irony, of course, from the community, from the point of view of the community organization, one of the ironies is that a great many people in our community are served very well by Michigan State Medical School, but they don't know that. And the two practitioners in our community are grads. So that's ironic. On the other hand, what folks need is, in that case, is good treatment, and they're getting it. Very often, I think what folks in a poor community need is not the data from the research that you want to do. It's good to share the data back, but for instance, if you're doing research on obesity, most of what folks need, the information that folks need, is already known. It's just not known in poor communities, and it's not shared in ways that changes behavior. So I think the point, you made the point actually already, I just want to really amplify it. We need to be, the university needs to be open to the understanding that the kind of presence that may be needed is not the presence of the researcher. That may be the presence that the university wants. But the kind of presence from the community's point of view may be a very different kind of trade. For instance, the Yakima example. But having some of those students go to that University of Washington makes them then participants, makes them part of that community. But similarly, having the university establish a permanent presence, as you have in Youthville and Detroit and a variety of other places, is another way of saying, you know, we're here, and we're here with what you need, which may be early childhood literacy, as Pete alluded to earlier, or maybe some other obesity training, or maybe something that leads to a degree for someone. But those are the, I think we have to be conscious that the whole university goes in with that researcher. And it is good to give the data back, and I appreciate the person in the back who said that, but giving the data back may not be the, you know, a poor community, it's just such an abstract notion that you're going to give sociological data back. You know, what we actually need is.
But where I've seen it be really successful is when it's research that's used, the findings are used for policy purposes, policy and advocacy purposes. So, for example, one of our members, Carol Horowitz, Mount Sinai School of Medicine, she's done a lot of work in Harlem with many community collaborating organizations on access to food, fresh fruit and vegetables in Harlem. Now, you know, from one standpoint, you could say, well, did you really need data to show that there aren't places? But, you know, for policymaker purposes, it was very influential to show the GIS mapping of where places could be, you know, where fruit and vegetables could be obtained and how much it costs. And if you had, you know, here's your average income in Harlem, this is what it would get you if you went shopping in your community. And taking that to the council, you know, the local council, and also interesting now the council members are behind getting a supermarket built, you know, so there's policy implications of the findings of the research. So it's not so much the study itself that really made the difference, but the partners were there to do that advocacy, and the researchers oftentimes are not necessarily either able to, skilled-wise, or for their academic position, able to really take it to the full.
But hopefully the university is thinking about bringing the vegetables too. You know, in other words, you might have to prime the pump a little bit.
Yeah,
you know?
yeah. Well, I mean, look, Portland State University, they have the most incredible farmers market on the campus of Portland State that's serving a very broad community. I mean, you know, stepping up to the plate in their own way that they can serve. Yeah, sure. Sure. Oh, let's hear from some people that maybe haven't spoken in the back. Sure.
I'm a graduate student, and I'm really into learning about participatory action research. But I'm also torn because I understand with professors and tenure and that process, they're getting maybe changes there, but as a graduate student, you're kind of pushed through the program and developing your own research agenda as far as like participatory action research. The programs don't want you hanging around 5, 6, 7 years to get your PhD. So really it's the how-to of kind of the system is how do you learn participatory action research if you're pushed through a program and not really developing authentic community partnerships, and then you get your PhD and you really want to do an authentic participatory action research, but you don't have the knowledge or the how-to to get it done correctly, and that. So I'm just kind of dealing with that.
Well, one question I would ask, and I just don't know for Michigan State, like, are there faculty here that have long-term relationships, partnerships doing CBPR that then grad students can become a part of? Like, it's a lot to ask at a graduate student level to be doing the whole thing. But where I've seen it work really well are when there are centers, like for instance these CDC prevention research centers or NIH funds export centers. You know, not all of them are necessarily doing full-blown CBPR models, but those that are, graduate students are coming through doing pieces, you know, maybe you're seeing elements of the project or you're seeing different pieces of the participatory process at different phases in different research projects, honing in something that you can get that dissertation on. But it's not the expectation that you have to develop the community relationship and do that whole, you know, that whole process, which does take time, but capitalize on the fact that those relationships and trusts are there with others, you know, is that a possibility?
I believe it's a possibility, but then you're not seeing the whole process when you're starting your own as a PhD person. You know what I'm saying? Like, as starting your own it's just, like you might understand that piece that you walked in on, did your dissertation on.
Right, right.
But you're not, you might have missed like the entree into the community, or you might have missed the dissemination process. Or
But that's what I'm saying, like if it's part of a larger process, maybe the piece that you do your dissertation on is just that one piece, but maybe you're seeing entree into the community around some other piece of that partnership project. I mean, that's a possibility. The other is that there are more and more, I mentioned the Kellogg postdoc programs, but that's one reason why that program started, was that acknowledging the fact that doctoral students are only going to get a slice of this most likely in what they can do in a doctoral degree. And it's a 2-year, in fact, it started out as a 1-year project, and then Kellogg funded it for 2 years because they realized to do a postdoc in CBPR, you needed that length of time for that kind of community building. And in that case, it's a lot of graduate students that are coming from a whole other community landing in this place for 2 years starting from scratch. So it's kind of building blocks. But are there comments that people might have or suggestions on that question here?
I think the assumption that there's some value in coming in and starting something from the ground up is probably inappropriate. And kind of coming back to the earlier comment, that if you're coming in for a short period of time, it makes sense to be assuming that you're part of a larger collaboration, that you're standing on somebody else's shoulders, and to recognize that that's the real part of the process. Process is not starting over every time and somehow assuming that you're going to be accepted into the community, or that somehow in a short period of time you're going to develop some level of trust. That those are things that happen over time, and that's appropriate that you do that in the context of a larger effort to build a relationship, and that it's the role of the Extension Center or the Youth Field Project or whatever, that the university can kind of do those kinds of things that makes it possible for somebody to come in and participate in an ongoing process.
Yeah, I agree. I definitely agree. Yeah.
Just a short comment. Substance abuse is not our first problem. Our first problem is land. We don't have, the government is taking away our land, so what are you going to do about it?
Yeah.
So things like that, and then so we realized, and I work for the university, and I work for the government as well at that time, and so we realized that the best thing that we could do was to start some sort of a partnership between the two, and not just to offer solutions to what we were interested in, but try to offer solutions to they thought it was the main problem for them, and that eventually will kind of help with the other issues or social issues. So, for instance, indigenous communities, so we kind of created a partnership with the University of Costa Rica and the government so that we could actually legally, give them the title of the lands and things like that. So we created this trust, of course, for a long time, over years. But then you create a trust not personally, not only individually, but they trust the entity as well. So they know that actually we are concerned about what their issues are, about what they think, the problems are. It's not what we think the problem is.
Right.
So it is a long time, and but it's just, again, it's just interesting to see that we face exactly the same thing.
It's the exact same thing.
So.
But it's a really good example of how you started, where the community really was, and built around that. And also, it does tie together. It's not just I'm here from the university, but I'm different than the rest of the university. You do carry the rest of the university with you, whether you really acknowledge and want to or not. And it does become a question of an ethical obligation, I think, if the community says, well, this is our priority. Well, maybe I can't really do much in that regard. That's not my area, whatever. But I have a whole university of people. So what's my obligation to be, at the very least, making connections, communications that might help, if not actually trying to mobilize, a response to it. It does become, I think, it starts to become a question of an ethical issue. Sure, yeah.
Actually, just to add to that, there's a book that I just got recently. It's called 3 Cups of Tea. I don't know if anybody's heard of or read that book. It's a great book. It's by a guy who was going to climb K2, the mountain K2 in Pakistan. And it's very difficult. It's one of the most deadly mountains, and he didn't make it. He actually developed a kidney sickness, was brought down, and he was actually being treated by Pakistani locals. And he heard every day, he heard kids playing, and then he would hear them quiet, and then he'll hear them playing again. So he figured there was a school nearby. And when he came out, when he got better, he asked the locals who had treated him, can I see the children's school? And they showed him, and they were all out in the fields, and said, where are the classrooms? where they said we don't have any to write in the sand and everything. So he said, okay, I'm going to build you a school. So he went to the United States, raised a lot of money, came back, said, now I'd like to build you a school. They said, well, hold on a second. We don't need a school. Kids are fine. All we need is a bridge. We need a bridge because the bridge that used to connect our two communities and all our family members on the other side, now we can't see them anymore because this bridge is washed away. It's just the story of how he actually built them the bridge first with that money raised and went back and then started to build the schools. So that's what you need to do, is actually you need to meet that need first.
Right.
But I was going to actually ask about something slightly different, which is in the area of trust as well. Sometimes when you're a researcher and you're working with the community, the findings of the research are very sensitive to the community. And they actually don't even want you to publish. I mean, they're worried about embarrassment, loss of money. And how do you handle that? Because on the one hand, you sort of, as a researcher, you feel a strong obligation, obviously, to publish this and get that information out. And it's your career in mind. But on the other hand, if you publish, you really break that trust. And it's going to be difficult to go back to the community the next time to work with them.
And you know what communities have really taken that on is the tribal communities, both in Canada and the U.S. that have, in Canada it's called the OCAP principles. The acronym I'm going to forget, but it's control and ownership and participation, but where they own the data. So tribal councils, many of them now, I mean, they won't let anything out that they have not read, reviewed, signed off on. I mean, one way to handle it is maybe a very obvious way, but is in terms of the anonymity of the organization you're writing about. And certainly, this isn't just about community kind of outside the university research. Like even if you're doing a health services research study on a university hospital that maybe shows that the quality of care you're giving, doesn't meet standards or whatever, but to say, it's a large urban hospital in such and such a city. But I mean, one way to handle it is to do it in an anonymous way that protects, the identity of that organization. I think the iterative process of talking with them about the interpretation of it might actually end up having some different, maybe what you're seeing is actually there, but there may be some other interpretations or other angles on it that they can bring in that would be useful to write about, as well as, as what was found that was sort of on the negative side. But have any of you faced this in your own work, that kind of, what have you done? Well, you've done a lot. You were telling me all of your evaluation work. And how have you handled that in terms of disseminating?
Well, a lot of it is exactly what you said, getting their interpretation on it, talking to them, having them have a lot of input on what the conclusions are about the data, but then saying that you have to be honest to the process too. And most of them are willing to do that because you've done the groundwork in the front of building the trust. But there have been times when I've done things where you come up with, say, something like an increasing length of stay. But if the increasing length of stay is producing better long-term outcomes, or at least intermediate term, then it makes sense, because in the long run, what they're doing is successful. So a lot of it is the interpretation.
And I think part of too is, and this doesn't solve the problem, but being very upfront from the beginning about what all the possible scenarios are. Right. When you're developing that research partnership, well, there's a scenario in which we're going to find that this program really doesn't work, or it does harm, or and really how we're going to respond to that. Just the same as being upfront about, I need peer-reviewed publications to be able to advance in my academic career. If we're going to work together, we need to really talk this through. But was there a case you were thinking of that?
Yeah, I'm aware of at least a couple of scenarios there where the data was sort of very sensitive, and it involved possible loss of funding to the community.
Interesting, yeah.
And so it was contentious for a while. We were able to resolve it.
Yeah.
But it has to be handled very delicately.
It's a major consideration.
Oh, we're getting a tea in the back. I'm sorry. It's almost time.
It is, yeah.
It's almost time. I hope I conveyed accurately at the start that this was going to be discussion oriented, because the morning and the afternoon are kind of more presentation style discussion. But I hope that it was helpful to get to know each other and hit some of the important challenges that we face. Thank you. Yeah.